Mr. Chairman, you got your bill out of your committee.
Thank you, Representative Kelly, and also I want to thank the Dean of the Dental School and those folks here from Augusta for bringing this bill and taking the time to be here. I know you're very busy. Thank you very much. Okay, let's do the next bill. And how about Representative Dickey, HB227. We'll be working off LC 550517S.
Right here,
Oh, okay. Yeah, that's
it
fine.
gets a little,
that's fine. You stay
that
over
chair gets a little warm over there. I thought I'd come over here with a little
I
more
thought
room.
you'd left. I was going, where is he?
Well, thank you for having me back in the committee. And our meeting last week, I appreciate the inputs and the suggestions. But, you know, as I was driving back down I-75 to Macon to Musella, you know, I kept thinking about the things I want to do in this bill, and it's only 3 things I want to do. But I really wanted to put the patients first, and I just wanted to get back to make sure this bill put patients first. And I don't think, in all our wisdom and all our efforts up here over the last few years, I think patients have gotten kind of pushed to the side, and we've got everything in place. Except a few minor adjustments. I think this bill would help put the patients first and make them aware of these products. And so I just sort of got back to the basics of this bill. Georgia is by far the lowest state, the lowest number of patients of anywhere in the Southeast with patients using prescribed medical cannabis, and I think it's this bill would help move that. First, as I said, it changes the name, replaces the term low THC oil with medical cannabis, and that's a change that's long overdue. It was 10 years ago trying to describe what this product was with a low THC. And so the medical cannabis simply aligns it with our medical Access to Medical Cannabis Commission, who is here, by the way, today, and I want them to speak behind me a few things. I reached back out to them after our last meeting, and they have been a tremendous help trying to focus this bill. Number 2, public awareness to existing patients, subject to the rules and regulations of our existing Medical Cannabis Commission. And then on the last page, taking away severe and end-stage conditions. No other states in the country or around us have severe end-stage. It's up to the doctors. Doctors has to prescribe this medicine. And so I just go back to trusting doctors with this and trusting the product. This product is produced right here in our state under supervised conditions, tested, dispensaries. It's got all the handcuffs on it with this legislature could put on it. And so that's really all this bill does. We did add lupus. Representative Schofield, there's some suggestions there. And so that's the bill that I bring to you today, the sub. And I'd like to ask Andrew Turnage, who heads up our Access to Medical Cannabis Commission, to come speak a few words, and his counsel, Jansen Head. You can do there or here.
I hear it's warm on this side of the room, so I'll take an empty seat, and I'll ask our General Counsel Jansen Head if you want to come up to the table in case I need to grab your elbow. Thank you, Chairman Dickey, and thank you to Chair Hawkins and this committee for the opportunity to come and speak to this bill. I'm Andrew Turnage. I'm the Executive Director for the State of Georgia's Access to Medical Cannabis Commission, and it is the Commission's responsibility for oversight of the growth, production, manufacturing, transportation, and dispensing of medical cannabis products in this state. We certainly have very much appreciated the opportunity and the invitation from Representative Chair Dickey to look at the bill. We've given it a thorough comb over, and we don't find anything that gives us heartburn whatsoever in the language of the bill. It's very much within the purview of the work that we do each and every day at the Cannabis Commission. I think it's aligned with the purpose of the HOPE Act and the work that we do with our staff and our appointees at the commission as well. The items, Chair Dickey did a perfect walkthrough, really took all of my talking points right out of my hands. It's exactly what I would have said. I think you can see the references in the bill on the items that Chair Dickey referenced. In line 21, you can see that there are adjustments there making the change from low THC oil to medical cannabis. That's what everyone knows the program by, but that language is just simply residual language from days before the creation of the commission. So I think that is a great cleanup. I think that awareness about this program is very important. Looking over at the language that you see with 241, line 241, this is work that we do, and it makes it really clear for those who rely on Georgia code to figure out who is the authority and what is the accurate source for information. It's important for people to know that they can come to this state agency and that this is the home to get the correct information about the licensees, about the products, and about the program. And I think that language makes it clear for some work that we've already been working very hard to do with our partners in state and local government, both at the county and the city level, about the program. As it relates to lines 269, it's really important for patients to get accurate information. I'm sure that all of you in the healthcare fields that are respective to your credentials and your work know that there's a lot of misinformation that people access. People rely on the internet, for example, as a source to find accurate information. We think it's important for patients to be able to get accurate information that provides an avenue for patients to get exactly that from those who are involved in this program. And last but not least, on the conditions, you can see some of the changes that start on 318. One of the things that Representative Dickey already touched on is that we do rely on physicians. This is a medical market. It is a medical program, and we certainly put our trust in the physicians as they certify those patients for their needs. So that's everything that I can think of, unless our General Counsel Jansen Head or Representative Dickey, if you'd like to add anything to that. We appreciate the opportunity very much to speak today.
I have a couple lights with questions. Representative Cooper, is that you? Okay, go ahead.
Thank you very much, Mr. Chairman. Okay, the first question I have, when you talk about awareness, several of us on this committee had questions about the awareness last time. Do you see that as running ads on television?
I think the language that's here makes it really clear that the commission can put the guardrails that are in place that are appropriate for the program. We've done similar things already with packaging and labeling. That language is already in the HOPE Act, for example. Things that make it really clear who can make the purchase, that it can't be appealing to children, that it's products that can only be sold in specific locations. Those are all programmatic pieces of information that we require of licensees, and I certainly see this as falling right in line with that.
Okay, but you're saying you could pay for television ads?
I'm saying that the language that's as written might allow for that, but you can see that the language in the bill would say that it's going to be subject to the requirements of the commission.
Okay, and Mr. Chairman, if how would you pay for those? Is there anything in the previous bills that would allow you to take grants, money from maybe the companies that produce this? I'm just curious about how you would finance it.
Mm-hmm. And just to clarify,
do you have the ability to take grants?
And just to clarify, Chair Cooper, when you say you pay for this, do you mean the commission pay for this?
Yes, of course.
Okay. So, again, the General Assembly is obviously the place where I come and present the commission's budget. And so the only information that we're going to be able to purchase with state tax funding is what this General Assembly approves for the agency. So I don't know if you'd like to add to that.
Yeah, if I could also respond. Again, I'm Jansen Head. I'm the Commission's General Counsel. Thank you for letting us speak. So we were here in the last committee meeting, and we heard concerns about TV ads, adding conditions. I think the purpose of that part of the bill, the substitute, was more so making sure that patients who have a card just know where to go. They go to gas stations, they go anywhere and think, well, it's got a marijuana lease, like I guess that's a regulated product, and it's not. We get calls all the time, where do I go? Currently, companies cannot advertise, so it's kind of like word of mouth. It's like the legal black market, where it's like, hey, you got your card, we can't talk about it, but if you go to Chamblee, you can get product there. And it's tough to tell patients, hey, go here for products that the state regulates. Now, with the concerns of TV ads, the difference between the original bill and the substitute is it puts authority with the commission to promulgate rules to ensure that any public information, well, not public, one, you can't advertise to the public, but you can advertise or share information to just the physicians, just their caregivers, and just the patients with a card. So there's no public advertising allowed. So TV ads, not allowed. Anything to the public would not be allowed. And funding for that would be on the licensees. We definitely don't have money for that, but the licensees would have to pay for that.
Okay, yeah, go ahead.
And
I-
this
I-
bill gives the commission the authority to regulate that information,
Right.
how it's presented. and
Okay,
given.
the main thing, all right, let me make clear, understand, because this is a concern of mine. Because you started off, we only have 1,000 patients and somebody else has 100,000 patients. I mean, I would, so we don't have to keep up with other states. And so right now, are you saying that you could give companies the ability to advertise, but it would only be to patients and so forth?
I think the issue here is just not knowing what advertise can mean. I think what the wording does in the substitute says, hey, the licensees can educate patients on what the products are. That's the real issue. So what this bill does is it gives the commission to promulgate rules, meaning we propose rules, and often we ask committees for input. We notify the committees, hey, we want to promulgate rules, let us know if you object, have feedback. And then a lot of times we get a lot of feedback from patients, from people who like the program, who don't like the program, parents, elected officials, and we are subject to the Admin Procedure Act, so we have to have public hearings, public comments. So all of our rules we have in place now that regulate packaging, labeling, how you design your store, how you design your packaging. If we had demos, not samples, but demonstrations of the packaging, it just looks like some kind of topical product. It doesn't have cartoons. It's not targeted to attract people. So how we regulate what the products look like or stores, it'd be the same way to regulate any kind of sharing of information. And the numbers, I agree, we shouldn't always compare to states, but I think that data that Chairman Dickey shared was more so not about advertising, but about the conditions, about how, because we require conditions to be severe and end stage, and we talked about that last week. Yes, he was just sharing that show, like, it is kind of hard to get a card here when you have to have severe end-stage cancer and things that pretty much every medical state doesn't require.